This program is paid for by Schaefer Eye Center and does not represent the views of this station.
The science of seeing better goes well beyond just an ordinary eye exam. At Schaefer Eye Center, our doctors and vision specialists use the latest in advanced diagnostic equipment to not only make sure your eyes are healthy, but that you are too. Of course, we can detect all the things you expect, like glaucoma, macular degeneration, and ocular hypertension, but also many things you wouldn't expect, like early indicators of more serious health conditions like diabetes and even brain tumors. Perfect vision. The freedom from wearing contacts or glasses can be yours with Schaefer Laser Vision. We helped pioneer the use of LASIK surgery in Birmingham over 20 years ago, and our own Dr. Jonathan Wilson has performed over 80,000 surgeries, including more than 300 eye doctors. Just imagine being able to see well into the future without wearing contacts or glasses. Of course, you already know Schaefer Eye Center as the destination for designer eyewear. Cartier, David Yurman, Sama, Robert Mark, Barton Pereira, Salt, Oliver Peoples, and many, many more. With over 3,300 frames available, we can help you find the perfect pair for your individual needs, style, and budget. The Schaefer Eye Center experience is all about you, but it begins with our people. Our doctors and vision specialists are committed to giving you the best in comprehensive eye care. Whether it's your regular exam, new frames, LASIK surgery, dry eye treatment, finding the right contact lens, or even helping you navigating your insurance options, everyone at Schaefer Eye Center is focused on one thing: giving you clear, comfortable vision. Are you ready to evolve your eyes? Experience it for yourself. Visit Schaefer Eye Center today. What does learning have to do with vision? Everything. At Schaefer Eye Center, our pediatric eye exam covers more than glasses and contacts. We like looking at the entire picture and how that child is doing in school. How are they processing the words on the page? That's the difference between a comprehensive pediatric eye exam and just an everyday exam for glasses and contacts. At Schaefer Eye Center, we take your child's future seriously, and the ability to learn and enjoy being at school is our goal. At Schaefer Eye Center, again, it's all about your children. No matter who you are, the Schaefer Contact Lens Center of Excellence will provide you with healthy, accurate, and comfortable vision. Bad habits like oversleeping in your contact lenses are a major cause of infection and vision loss. Our doctors are contact lens experts. We will ensure the safety of your vision. Young people in contacts are at a high risk for complications. We will be your ongoing partner in their vision care. We take your child's eye health seriously. I am so excited about children. I'm so excited about Schaefer Eye Center and our new pediatric department. You know, I'm with Dr. Nicholas Onken, and Nick, you know, first of all, I love having you at Schaefer Eye Center.
Thanks for having me, I appreciate it.
You know, we know that our children are our future, and it's our responsibility to take care of them. So we decided to bring in a pediatric specialist so that when your child has an eye exam, they don't just get an eye exam, they have a special eye exam just for them. We're going to talk about all parts of this. It's going to be not just the eye exam, but what happens after the eye exam and if there's any issues and where we go with that. So let's first start. What is different about a child's eye exam versus an adult eye exam?
A child is more than just a small adult. They are still learning to see. The visual development system is still going. We need to make sure that everything's set up just so that the visual system develops perfectly how we need it.
And talk to us about eye movements, because in an adult we always test movements of the eye, but we're looking more for gross disease. But on children it's a little bit more than that, isn't it?
There's a lot more to that. They need very fine movements because most kids, they're learning how to read. And if they have trouble moving their eyes across the page, they can't learn how to read very well. Comprehension goes down, frustration goes up, and they struggle academically.
Now, doing an eye exam, I know your eye exam takes a little bit longer with children. A lot of you feel, well, it's just my child, that we're going to get them in and out quickly. How long do you spend on a pediatric eye exam?
As long as it takes. I'm in there. I like to get to know them, make it so that they don't feel scared of me, that they're comfortable with me and can give me the information I need. I use objective information, subjective information, and look at things multiple ways so I make sure I'm getting the right measurements and what the child needs.
Now, I know some of the special tests we do, let's talk to our people about convergence, which means the moving of the eyes in. We know something called convergence insufficiency. It's rampant in kids because, again, they haven't learned. So let's explain about what convergence insufficiency means and how common it is.
Our eyes need to be able to converge or move in towards each other when we're looking at something, say a book or homework. A lot of kids have trouble moving their eyes in. As a result, they can see double, they can get blurry vision, they can get headaches, and that makes it hard to learn, hard to read. It's one of the most common learning vision problems. Up to 20% of kids have an undiagnosed visual learning problem that their parents or teachers don't know about.
Yeah, so if your child is having problems with school, any kind of problem, especially reading, or they're reading slow, it's important to get the right eye exam. And not everybody can do this, and that's why we brought in a pediatric specialist, because these tests are special done just on these kids. Because again, about 20% of people you see have some type of issue that in the past we wouldn't do anything about. We're going to talk about what we do about this in a moment. But the other thing is, when you're examining these children, whether they have a convergence insufficiency or learning, a lot of people say, well, my child skips words or reverses letters. While we used to say that's okay, it's really not okay, is it?
It's not okay. The visual system is developing in these kids. Up to a point, some errors are okay, but once you hit a point, learning will go down, frustration, like I said, goes up, and we can evaluate and make sure the eyes are moving correctly, and we can also make sure that the visual system is processing that visual information correctly.
And another key issue is children on meds, especially ADHD. If your child is taking any kind of medication, it's going to affect their focusing and their ability to, could you talk about the little effects of all the medications that are used to help a child learn today? What is that doing to the eye system?
It actually turns out it shuts down a little bit of the peripheral vision system. We need peripheral vision so that we can see where our eyes are going to jump to, say when we're reading words on a page. If we don't know where we're going to jump to, our eyes are not going to land on the word that we need to. And so researchers have discovered that actually patients with attention deficit disorder, ADHD, also struggle with eye movements.
And what about focusing? Does it not have a focusing issue?
Absolutely. So if we're trying to look at the page, they might be looking at the correct word, but if it's coming in and out of focus, they'll really struggle understanding what the word is and what it means.
And so that is, again, part of the extensive testing we do. And I'm just excited about our program. So when your child needs an eye exam, you know, it's like a commercial to each other. You know, at Schaefer Eye Center, we're so proud of this pediatric department, what you're doing. I can't tell you how important it is to all of us in the Schaefer family that we have doctors that are doing something special for your children. So when we come back, let's talk about when your child is on a medication and or having reading problems or anything else. What do we do about it? And we'll talk about that next.
Love it.
Whether it's your regular exam, new frames, LASIK surgery, dry eye treatment, finding the right contact lens, or even helping you navigating your insurance options, everyone at Schaefer Eye Center is focused on one thing: giving you clear, comfortable vision. Are you ready to evolve your eyes? Experience it for yourself. Visit Schaefer Eye Center today. Well, we're talking about the Schaefer Eye Center Pediatric Department, and we are so excited that we have Dr. Nicholas Onken, a pediatric specialist, with us. And we talked about the eye exam. How important is your child has an eye exam for learning, and not just about glasses or if they're healthy, but everything else that has reading and or other disorders. Now we've diagnosed some. So let's say somebody does not cross properly, meaning they have convergence insufficiency, or they have accommodated, which is a focusing problem. What do you do? What kind of therapy do we have that we can fix that?
We have optometric vision therapy. Optometric vision therapy is active in-office visits. You come visit us here in the office once or twice a week. We do games, exercises, activities to improve the patient's ability to use the eyes together as a team and to improve the focusing and the tracking systems of the eyes.
So if my child has ADHD or is on medication, we find some of this, or if they're not, and they have 20/20 vision but they're not reading very well, how long do you have to stay in this program?
You know, it depends from patient to patient. On some patients, we can knock it out quickly within a month or two. With other patients, it may take 3 months, 6 months, a year. It depends from patient to patient. We take each patient individually.
So when you have these patients, they come in the office once a week, and who do they work with? Are you there, or are they working with?
Yeah, right now they're working with me. We're training up vision therapists. These are specially trained therapists that are skilled in the treatment of learning-related vision disorders, amblyopia, and strabismus.
So, you know, the neat thing is when you watch these therapists work with their kids, I mean, they love these children, and they watch for the little changes, and that's what's amazing. We have someone with them for how long? How long are they in the therapy program daily?
Oh, 45 minutes.
So 45 minutes of concentrated therapy, and you can watch, and you can actually, I assume, see changes as they go along.
Absolutely. We're changing lenses. We start out with easy lenses, work up to hard lenses, and we're adding things to make the experiences more difficult as the older activities become easy.
And one of the things that we like to see is that smile on the child's face, you know, because children know that they're not reading. They know it's almost painful to read, and then they go through the therapy, and we give them the confidence. And tell me what your feeling is when you see that child after 2 months really progressing. What does that mean to you?
It's amazing. What we've done is change the trajectory of the life of this child. A kid who is early in elementary school and doesn't like to read, what is their potential for reaching college if they don't like to read? It's not very good. So if I can change that around, now reading is comfortable, they enjoy reading, they're going to be learning more, enjoying more of school, and we've ended up changing a life. It's amazing.
So, and again, I want to thank you, and to all our friends out there that are watching. Again, all children's eye exams are not the same. Pediatric eye exams, they can be very basic for glasses and contacts, but more importantly, it can be a full learning issue. How do we make that child better? And the last part I want to talk about is myopia-controlled nearsightedness. We know when we come back that we will discuss all about nearsightedness.
I jump from screen to screen, and my contact lenses get dry and uncomfortable. My eye doctor said my lenses may lose moisture because we blink less while staring at screens. So now I wear Bausch & Lomb Ultra contact lenses. They discovered a way to store water inside the lens with Moisture Seal technology and help retain moisture for 16 hours, even when I'm staring at screens. Wear them free for 1 month. Visit ultrafreetrial.com today.
We're talking about the Schaefer Eye Center Pediatric program that we are so excited about. I'm with our pediatric optometrist, Dr. Nicholas Onken, today again, talking about all the things that we have to do for children. Number one is an eye exam. An eye exam not just for glasses and contacts, but an eye exam for learning and how the eyes are teaming together. It's really a higher level of care. We know that's important today. Second, we talked about what happens when there is something that's not right, or your child's not reading properly, not learning, or basically just not enjoying school. We have programs for that, and we talked about that, how we can really get them back on track. The last and most important part is myopia control, nearsightedness. If your child is nearsighted, we know that we can slow down that pattern. It's an epidemic today because of all the PDAs and computers that people are using. Our children are becoming more nearsighted than ever before. And today we have things to stop that. We can slow it down. There is evidence-based medicine to show this. And there's three basic categories. So let's talk about the three categories. The first is multifocal contacts and multifocal glasses. Explain how that works.
They work two ways. One is these specialty lenses change the way the light falls on the retina. It makes it so that the retina actually has no signal to continue to grow. And that is what causes a lot of nearsightedness, is an elongation of the eye. So we can slow down that signal, the eye will not grow, and the prescription will stay low.
So it's very important that if your child's going to wear glasses, let's look at options. If they're going to wear contacts, we definitely have an option that will slow down their nearsightedness.
Right.
And at Schaefer Eye Center, we see that child every 6 months because we know wearing the exact prescription, that alone will slow down the nearsight a little bit. The nearsightedness. The contacts is the next level that will slow it down. And next we have orthokeratology, or corneal refractive therapy, which is actually what? Explain that process.
This is a rigid contact lens. It's worn only at night. So the child puts it in the eye right before going to sleep, wakes up in the morning, takes it out when they wake up, and can see perfectly all day long with no lenses and no contact lenses. It also changes the way that light falls on the retina, preventing the eye from growing anymore and keeping the prescription about the same.
So now we have the second thing is we actually have a child sleep in a lens, and the child during the day doesn't even wear glasses or contacts, and on top of that we will slow down the nearsightedness even more than wearing the multifocal contact lens. And lastly, we have atropine, which is a drug that we put in the eye that partially paralyzes the muscle. Let's explain that one.
A lot of the researchers, they say that it's part of this, the paralyzing the focusing muscle. Otherwise, part of it, they don't really know what goes on. But for sure, it tends to slow down the rate of changes of prescription. It tends to be our last case scenario because there may be some rebound effect afterwards. So we prefer the either of the contact lens options.
Right. So we have multiple options to slow down that nearsightedness. And you might say, well, what's the difference if they're a 3 or a -4? It's a big difference. As they get older, the more nearsighted you are, the more chance you have to develop glaucoma. The more nearsighted you are, the more chance you have of developing retinal detachment. So we're actually not only saving vision and the thickness of the lens, we're actually keeping them healthier long term as you look down the road. So Dr. Onken, it's great to have you here. It's great to have a pediatric department at Schaefer Eye Center. So if you have any questions, you can call 979-2020. We have a call center, and you can ask for the pediatric department. They can ask any question you need about having an eye exam for your child and helping your child really excel at reading and at school. Thank you very much. I hear all the time, my child's getting nearsighted. What can I do? There's plenty you can do. At Schaefer Eye Center, our pediatric department has an entire program to slow down that nearsightedness. We don't have to keep getting thicker glasses every year. It's a 3-part program that is very comprehensive, and the most important thing is that child will see better for the rest of their lives with less of a prescription. It just takes a few minutes to let us do the comprehensive eye exam and determine what is the best program for your child. Their future is bright. Let's help them get there.
Evolution is a constant. It knows only one direction: forward. Hey! Advancing, adapting, modifying, learning from every moment, every experience to transform right now into what's next. Because vision is evolving. Are you?
We're discussing Schaefer Eye Center's pediatric department and so many different aspects of that. And one thing we have yet to talk about is at what age you get an eye exam. And I know we have a program through the American Optometric Association called Infant C, where all children should have an eye exam, including infants. So first let's talk about infants, because most everybody today, children are covered in your eye plan. So all eye exams are covered. And we think it's important that actually you see a child when they're an infant. Tell us why.
Without a doubt, the baby does not come out of the womb with a fully developed visual system. In fact, that visual system isn't fully developed until ages 7 or 8. And if things are not set up properly when the child is young, that system will not develop properly. So if we see the kids between 7 and 8 or 9 months, then we can make sure if there are any obstacles to this vision development, we can make sure to hit it early on.
But obviously they can't talk. They're not going to do, you're not going to do glasses, and most kids, I mean some, but it's rare. What are you looking for?
Mostly just making sure that the eyes are nice and healthy. We want to make sure there's no big difference between the prescriptions of the eyes. We want to make sure there's no eye turn. Basically make sure everything is set up so that the vision can develop normally.
Now also, age of eye exams for children. At what age? Obviously, we see a child when they're an infant and there's no amblyopia, no differences where they think that they're not going to develop well. At what age should you bring in your child to have an eye exam?
If not at 6 to 8 months of age, before kindergarten or before preschool, definitely.
So it's very important. You know, right before kindergarten, reading today is so demanding on our children's visual system. I really think it's so important. Bring them in as an infant. Dr. Donkin's happy to see them, and or wait, but see them before kindergarten. Make sure they have an eye exam, because today you want your kids to excel with all the work they have to do up close. Again, it's great to have a pediatric department. It's great to have you at Schaefer Eye Center. If you call our call center at 979-2020, all your questions will be answered, and we're happy to see your child and make sure their future is bright. The science of seeing better goes well beyond just an ordinary eye exam. At Schaefer Eye Center, our doctors and vision specialists use the latest in advanced diagnostic equipment to not only make sure your eyes are healthy, but that you are too. Of course, we can detect all the things you expect, like glaucoma, macular degeneration, and ocular hypertension, but also many things you wouldn't expect, like early indicators of more serious health conditions like diabetes and even brain tumors. Perfect vision. The freedom from wearing contacts or glasses can be yours with Schaefer Laser Vision. We helped pioneer the use of LASIK surgery in Birmingham over 20 years ago, and our own Dr. Jonathan Wilson has performed over 80,000 surgeries, including more than 300 eye doctors. Just imagine being able to see well into the future without wearing contacts or glasses. We've talked about Schaefer Eye Center, our new children's initiative. Contact lenses are the most important thing that you can do with contacts and make sure that our children take care of their eyes for a lifetime. Emma Kate is a contact lens wearer. So not only do we have great technicians like Alex here that is training her how to put the lenses in and out, which is really the simple part, it's also how they take care of the lens. We know that children have the most problems of all demographics due to corneal ulcers, infections, and just not taking proper care of the lens. That's why we see all children every 6 months. Schaefer Eye Center has a rule: if a child wears contacts, anybody under 16, they will be seen every 6 months, so we make sure they're taking good care of the lenses, right?
Yes, sir.
And we make sure that you love your contacts, don't
Yes,
you?
sir.
And we saw Emma Kay trying on glasses because all children that wear contacts should be wearing glasses. Then when we go in the exam room, we're going to talk about nearsightedness and children controlling that nearsightedness. If we fit the child properly and the right kind of contacts, there are studies now that shows that we can stop their nearsightedness by up to 40%. That's what I said. 40% reduction in nearsightedness just by wearing the right kind of contacts. So that's you, Emma Kate. Well, you're not going to be nearsighted anymore, right? And then when she does, we'll fix her with laser surgery. Isn't that right?
Yes, sir.
Yes. No matter who you are, the Schaefer Contact Lens Center of Excellence will provide you with healthy, accurate, and comfortable vision. Bad habits like oversleeping in your contact lenses are a major cause of infection and vision loss. Our doctors are contact lens experts. We will ensure the safety of your vision. Young people in contacts are at a high risk for complications. We will be your ongoing partner in their vision care. We take your child's eye health seriously. If you are wearing monovision contacts, one for reading and one for distance, a better option is multifocal lenses. Your vision needs evolve over time, but you deserve precise, effortless vision. If your eyes hurt by the end of the day, you could suffer from dry eye syndrome. Using the latest medical technology, our doctors will customize your treatment to give you clear, comfortable vision. Trust in the expert care at Schaefer Eye Center. At Schaefer Eye Center, we've talked about the Children's Initiative, and people ask us all the time, how old should I be to have an eye exam? So Maddie, how old are you? 2? 2.5? Yeah, how about that? 2.5 is a good age to start. But what about an infant? Because we have something called infancy. If you have a child that is under 6 months of age, an eye exam is free, because we like to know how their vision is from that age to make sure that they are seeing well. Actually, Dr. Kaplan's under 12, right?
Under 12, 6 to 12 months.
6 to 12 months of age. Edith, how old are you?
7.
7, and she's had an eye exam because when you enter the first grade, is that what you're in, first grade? You have to have an eye exam to know how you're going to compete in school and make sure you see well. And McKay, how old are you?
12.
12. Are you driving yet?
Yes, sir.
No, I don't think so, but I know you've had a lot of eye exams, right? Because her father's a doctor at Schaefer Eye Center. And Foster, how old are you?
11.
11, and she's had lots of eye exams because her mother is a manager at Schaefer Eye Center. So we have all the families. Dr. Kaplan is looking at Foster's eyes and McKay. And I want to thank y'all for being part of this whole children's program. Again, I explained this earlier when we were talking about contacts, but every one of these children have a good chance they're going to be nearsighted. And we know today, with special programs at Schaefer Eye Center, we can slow down that nearsightedness. And this has started at the University of Houston and now moved to Australia, and soon at Schaefer Eye Center, because we have programs that will hopefully help your child have a 40% reduction in nearsightedness as they get older. And it's not just about less nearsightedness. When they get older, less glaucoma, less retinal detachments, less medical problems, because we started at this age to make sure you're wearing the right contacts and the right glasses. Again, thank you for watching, and thank you, everybody. Wave to your friends. Say goodbye.
Bye.
At Schaefer Eye Center, our new children's optical is just phenomenal. It's so much fun. Kids like these are just having a great time. Foster, what do you think? You love trying on glasses? It's so much fun. How about it, Edith? Show us a great pair. And Edith will show you that kids can just have a great time. We have such a great selection because, again, children love the coolness today. They love the colors. And Maddie, what do you think of your yellow glasses? They love them. Again, at Schaefer Eye Center, we're not just about style for adults. We're about making children happy. Is your child having a difficult time with reading or just not enjoying being at school and learning? Well, it may be more than just them. It may be their eyes. Because if your eyes don't focus together and they don't have the right type of movement, they can really make it difficult to read. At the Schaefer Eye Center Pediatric program, we delve into these issues as to what is causing that problem. Because it's not about glasses. It's not about contacts. Their vision may be 20/20 and they may see perfectly. They just don't process the words properly. So be sure you observe how they're doing with their reading, how much they're enjoying it. And if there's any issue, please call us at 979-2020 and ask us the questions of what is this we can do to help them.
This program is paid for by Schaefer Eye Center and does not represent the views of this station.